And we're going to define the roles of the stakeholders, the parents, the school team, and the medical team that play a significant role in keeping these children with chronic illness connected to school. So what does chronic illness look like? Can you really point out the child with chronic illness in this picture? The answer to that is no, because chronic illness is invisible. Most children that have a chronic illness, there is not a telltale sign physically that they are not feeling well, that they might be suffering from cancer or a blood disorder or cystic fibrosis. I mean, obviously, a student that may be actively in cancer treatment may return to your classroom and maybe have some significant hair loss, or their face might be a little bit cushiony from steroids, but there is really no specific telltale sign of any chronic illness. So, what is chronic illness? Chronic illness is defined as a health condition that lasts for 3 or more months, and it is prolonged. It does not resolve spontaneously, and it is rarely cured completely. In 1 in every 5 children under the age of 18 is diagnosed with a chronic illness, and in a classroom of 25, 5 students will have chronic illness, and as many as 3 will require academic interventions and medical support throughout the school day. So what are examples of chronic illness? Besides some common ones that we know, students may return to school with cancer, ADHD is a chronic illness, diabetes is a chronic illness, obesity, and even food allergies are chronic illness. So we really need to put into perspective the population of students we're serving and what they're bringing into the classroom. So what do we know about these chronic illnesses? We know that these children require medical treatment, and that treatment affects their academic functioning and can cause fatigue and reduced stamina, irritability, decreased attention, impaired learning. They come to school, they're tired, they're drowsy, and these things actually affect how they are performing in the classroom. Children that are on chemotherapy or other medications often are fatigued, nauseous, and when you're tired, you really just cannot perform the way that you are expected to and the way that you want to in the classroom. And we also know that the health of a student really affects their performance. Education and healthcare leaders agree that the health of a child and their school performance are dynamically intertwined. They go together. If a student is feeling well and they can engage in what the teacher is saying and with their peers, their performance is much better than if they're not feeling well. They're fatigued, tired, have a stomach ache, have side effects from medication. Their school performance is really going to be decreased. So what is school? Well, besides providing a place for students to learn and stay connected to their peers, where students feel success and they develop independence, it's their job. School is where they belong. Children, whether they are perfectly healthy or have a chronic illness, they need to be in school. School provides them with self-esteem, and it provides hope for the future. And it's a place for children with chronic illness not to be viewed as a patient. They're just a kid doing what every other kid their age is doing. So when you have a student with chronic illness in your classroom, it really affects everybody. The student is affected, the parents and their siblings are affected, classmates, the entire school community, teachers, social workers, psychologists, the principal, the nurse. Their friends are affected, and even far outreaches to the community. If a student is involved in football or dance or soccer, and they're all of a sudden not able to participate in that, that's affecting the community as well. So these students face many challenges. The challenges that they face are their medical conditions. They are aware of it, and we are advocates in this field to really let the child know about their diagnosis. It's important for them to become advocates for themselves as early as they can. So but the more information they have about their medical condition, the better they will be to advocate for their needs throughout the school day and throughout their lives. So they have challenges with their medical condition, their body image. Sometimes, they may look differently than their peers. Children with cancer may return to school with little or no hair. They may have other issues. They may have a port implanted where the blood is taken or where medication is given. So their body image is different. They lack control. Sometimes their emotions fluctuate due to the medications. And if they miss a significant amount of school, they are socially isolated from their peers. And parents face these challenges as well. When their child is sick and then they all of a sudden are clear to return to school, they are filled with fear. They're afraid their child is going to be teased. They also feel like, how are they going to adjust socially? They've been out of school for a significant period of time, and even 3 days is a significant period of time. Any time when a child is not doing what they are supposed to be doing, going to school, their job, they are isolated from their peers. So parents really feel overwhelmed because not only are they now facing that their child's returning to school, but they still have that medical care that they have to really think about throughout the day. And it's difficult for them to say, oh, I'm going to send my child back to school and I'm going to have the nurse or somebody else in the school look after my child. So the chronic illness not only affects the student and the parent, but it really then now becomes an effect in the school as well. So the next people that are really affected by this are the teachers, because now all of a sudden a child with a chronic illness is re-entering their classroom and they become fearful as well. So fear is really just the driving factor for everybody, the student, the parent, the teacher, the entire school population. They're afraid because they really don't know anything about that medical condition, or if they do, it may be something that they may themselves experience or somebody in their family experienced. And not everybody experiences a chronic illness and its side effects in the same way. So they may come with preconceived misconceptions about this student or their chronic illness, and they're unsure of their role. How are they going to face that? They're thinking, oh, I have somebody that may have had this chronic illness and they were really sick. They had a lot of complications, and now this student is coming into their classroom. They really don't know how to handle that, and they're unsure of how the classmates and even parents, how they're going to react. Sometimes, parents say, oh, I don't want my child in that class with somebody with a chronic illness, and it's really important to make sure that everybody working with this student receives the education that they need about the chronic illness. So chronic illness has an impact, a medical, psychosocial, academic impact. And the medical impact, like I had said earlier, is like we want the child to know about their medical condition. They need to know about their diagnosis, the treatment, and the side effects. And this is something that it needs to be shared with the school as well. There's also psychosocial difficulties, the isolation, keeping kids connected to school, teachers, and classmates. How do you do that when they might not be feeling well? They're sick. They might have side effects. They might be in the hospital for an extended time receiving treatment. So they are isolated. And then that isolation leads to, how am I going to keep up? How am I staying on track? These are all things that have been expressed to many medical and non-medical personnel working with this population of students. They just, how are they staying connected? How am I going to stay on track? And then there's frequent and prolonged absences. And we also need to take into consideration that a child does not need to be absent from school for weeks or months on end. 1 or 2 days a week, intermittent absences. If they come for treatment on Monday, they return to school on Tuesday, but really the treatment's starting to take effect and they're not in school on Wednesday. Those 2 intermittent days throughout the week cause significant educational deficits for the student. So what do we do about these frequent absences? And, it's really great that home and hospital-bound instruction is provided for these students. And children in kindergarten through 5th grade receive 1 hour a day or 5 hours per week. And our high school students receive 2 hours a day or 10 hours per week. But approximately 1/2 of the students with chronic illness are absent 4 times more than their healthy peers. And like I said, even in, it's not just prolonged absences. It's just that intermittent absence. 1 or 2 days a week, every week, is a significant time to be absent from school. So we really need to think about if a child with a chronic illness is returning to school, does the home instruction really need to end for them? Or do we really need to keep that home instruction going so that way when they are absent for those 1, 2, 3 days per week or per month, can additional supports be given to them? So psychosocial difficulties. The real reason for these psychosocial difficulties are those prolonged absences. So those prolonged absences then lead to fear of rejection. I've been out for so long. Are my friends going to remember me? If a child is diagnosed with cancer in the middle of the school year, the likelihood that they are going to return to school in September is not very likely. So they almost miss 6 to 9 months of the school year. So they might be diagnosed in first grade, but they're returning in the middle of second grade. So are my friends going to remember me? So they feel rejected. They have difficulty adjusting when they return to the social demands of school. They avoid interaction with their peers, especially preteens, and they're concerned about their physical appearance. Just recently, I worked with a patient who was an 11th grader and was diagnosed with non-Hodgkin's lymphoma, which is really a short time to be treated for cancer. It's about 3 months. So she was going to be out of school for 3 months. When it was time for her to return to school, we advocated for the accommodations that she needed, and her mom called me up and said, Cara, she just doesn't want to go to school. And I said, why not? And she said, because her hair was her identity, and now she's going back to school with a hat on, which we got approval for, and it's in her 504 plan, but she doesn't want to wear a hat. She doesn't want the kids in 11th grade to look at her and say, well, why are you wearing a hat? So she lost her identity. She's concerned for her physical appearance. So she was really refusing to go to school. And, I had to meet with the medical team and the parent and, with her physician and say, well, what are we really going to do? What is in the best interest of this student? Are we going to force her to go to school when we know she's going to go to the nurse and she's going to be sick and she's going to have to come home? Or are we going to continue to advocate for her to receive home instruction until she feels comfortable enough to be re-immersed into the school and to not even just keep up with the academics, but to fit in with every other 11th grade girl. So each case is always very unique, but we really need to specifically think about that. And with school refusal it's very difficult, and medically, I do not know of any medical colleague that wants to leave a student, to say a student should be out of school. And if they are, counseling needs to be put into place that is working so they can get them to participate in school for the next school year. Because oftentimes once a child is not in school, it's very difficult to get them back to school. So along with the medical and psychosocial, there are academic difficulties. There's difficulty meeting curriculum requirements. Concentration, memory, attention span, and processing speed are all affected. And it's not only illness-related, but it could be medication-related. Oftentimes the illness is managed, but it's the medication that's causing them to lack concentration, for their memory retrieval to be delayed. So we really need to think of these things when we're working with this population of students. And we also need to know that these students are constantly playing catch-up. And that there's increased anxiety for this. This is often another time where we might see that a child does not want to return to school because it's just very anxious for them. It makes them very stressed. And the illness itself may not cause learning difficulties, but it's the actual prior history that the student may have had some learning deficits that the illness only compounds. So students with chronic illness are capable of learning and continuing to learn, but they are at risk because their illness and side effects does not allow them to be engaged in those high-stakes learning standards. They can't be engaged because they miss a lot of school, but they also can't be engaged because their concentration is just different. Their learning style may have changed. Oftentimes, a student may have been more of an auditory learner, but now they're coming back to school and they have to figure out that the way I used to learn has now changed due to medications or the side effects of the illness. And we need to keep in mind that the student school performance doesn't change when they're diagnosed with the chronic illness. It just becomes more pronounced. So what works? Well, what works is really bridging the gap between the medical team, the hospital, and school team. And there are programs out there called school intervention programs, which is really best practice, where a team comprised of a medical professional, maybe a nurse practitioner or a nurse, an educational liaison, somebody with educational background, go to the school, and they provide the teachers and other staff members with accurate, timely information about that specific medical diagnosis and how it impacts the child psychosocially and academically in the classroom. Additionally, these programs offer classmates the same accurate information. It is very important for our students, classmates, to really have as much accurate information about the child's diagnosis. We need to demystify anything that children may have heard from their parents. Childhood cancer is very different from adult cancer. So classroom presentations or read-alouds or character-building activities are optimal and paramount in really reconnecting this child into the classroom. In professional development and in-service training, and constantly addressing those unique medical, psychosocial, and educational needs of the student. So when a student is absent from school for a significant period of time, the most important thing is keeping them connected, because we find that when they are connected to their peers, it makes it a lot easier for them to return to school. I am a big advocate for Skype, FaceTime, and even a really unique robot called the Vigo that actually walks around the school building with the child Skyping in through that to keep them connected to school, because I'm a firm believer if this child is connected to school and their peers can kind of get a little glimpse, even if it's 45 minutes a day or even 15 minutes of what that child is experiencing, what their classmate is experiencing, that reentry to school would just be so much more smooth. So, it's very difficult to, find the perfect time to Skype, but just during a read-aloud, if you're doing a science experiment, any way to engage that student and to bring that student who's home or in a hospital bed into the classroom. A mystery caller, with cell phone in the classroom, the teacher could say, hey, let's call Susie and see if she could guess what we're doing or what we're learning or who this is. With email, you could communicate, send letters, set up pen pals, keep a journal where the classmates, write something that's happening in the classroom in the journal, and it could go home with a friend or a sibling. A collection box. Students could write notes when they feel like something is happening, or just put a little note in the collection box that says, hey, how are you doing? We miss you. Put classroom updates in it, and then again, that could go home with a friend, a sibling, somebody that lives nearby to that student. Students with chronic illness, although they might not be medically cleared to come to school every single day, they may be medically cleared to come to school for an event that's happening in the building or a classroom party. So open communication with the parents or even the student, if the student is old enough, to say, hey, can you get medical clearance? We're having a party. Can you get medical clearance to come? And most of the time, if the student counts are okay, they're not immunocompromised, the doctor will medically clear them to come to school for that 45 minutes. There's also a monkey in the chair, which is like a national organization that provides the classroom with a monkey. And that monkey comes with a story that talks about chronic illness, and it holds the student's seat in the classroom. My program that I worked for previously, we had a lion because we feel that our children with chronic illness are brave and that the lion would hold their seat. And we've had many students that the lion was brought to lunch. It was brought to library. It was brought to gym. It really just took the place and just really let the children know that this student was still connected to the classroom. So what are the effects on school performance for children with chronic illness? Handwriting, because often medication causes like a neuropathy or a tingling in the fingers or the toes, so the handwriting either changes or it's difficult for them to grasp a pencil. Their reading comprehension, understanding math facts and concepts. Many times I have children come to me and say, Cara, I know my math facts, but, when I had to put it down on a piece of paper, it took me so long to remember the math fact that I couldn't answer the question. So that's why we try to advocate for the use of a calculator. Do we really want them to know the fact, or do we want them to know that fact and how to use it in a concept? They have difficulty with auditory and visual processing, short-term memory and information retrieval. Often students that are on steroids or might be taking chemotherapy, they know the answer, but it's just so difficult for the answer to be processed. So it takes longer for them to retrieve the answer and to call it out or to participate in a classroom discussion because it just takes so much longer. Planning and organization is something that is significantly affected for children with chronic illness. It's just we don't know if it's due to the medication, if it's just due to the fatigue or caused from the chronic illness, but they just cannot stay organized. And because of their psychosocial disabilities, their maturity and their social skills are often behind their peers. So what can we do as educators? So there's many tips, and when advocating for students returning to school, these are some of the areas that I really focus on. So physically, we advocate for frequent rest periods, and it's not like a frequent fly to the nurse's office, but if there's a specific time that a child maybe feels fatigued, we ask that maybe they could go to the nurse's office for 10 or 15 minutes, get a drink, lay down, and then return. Modified PE and PE as tolerated. Most medical teams are not advocates of putting children with a chronic illness into adaptive PE. Again, as I said in the beginning, we want them to really learn how to be advocates for themselves. So we want them to have modified PE, where they can maybe say, I can't run the mile, but I could, walk a half mile, or I can't really, throw the basketball, but I could keep the score. So we want them to keep them connected with their cohort of students. So we really don't want them to go into adaptive PE unless they have a true physical or medical reason for them to be taken out of regular PE and put into modified PE. Often medications make the children very hungry or they need a drink, so we ask for access to food and drinks, unlimited bathroom privileges, and a second set of books to be at home, because the heavy backpack on a child that's fatigued or not feeling well is just sets them up for further complications at home, because if they a backache or something may just actually compound how they're feeling. The emotional, a contact person in the school besides the classroom teacher, somebody, the nurse, a social worker, a psychologist, a coach, somebody that could just check in, maybe just walk by the classroom door, peek in, give the student the thumbs up. The student gives the thumbs up, they know they're okay. If the student gives the thumbs down, then that's a signal, that they need to just come out of the classroom just for a few minutes. Adjustment to attendance policies. Can the student come to school on a modified or shortened day? Can they come, twice a week? and continue to get home instruction. It's really about being as creative as possible based on the student's needs. And when it comes to academics, preferential seating, we find that students with chronic illness often are better able to focus when they're seated closer to the classroom or to the lesson. Repetition, guided note-taking, or even a copy of the class notes in a place with minimal distractions. They need color coding, highlighters to help them stay organized. Books on tape, because oftentimes they just need that auditory stimulation. Voice recognition software. They would need, we always advocate for testing, modifications, and accommodations. As I said previously, use of the calculator. Do we want them to know that they understand the process in solving the math problem, or do we want to know they know the math facts? So if we provide them with a calculator, they can plug in the math fact that they really know, it's taking them longer to retrieve, or do we want them to show us mastery in the concept? Using a computer instead of handwriting, because I had said that sometimes neuropathy or just hand fatigue causes them not to be able to write as quickly as their peers. And again, the second set of books at home just to help them bring the supplies back and forth without having any further complications. So currently, the needs of students with chronic illness are being met by the free, appropriate, and education laws. Many of our students are placed in the least restrictive environment, and many of our students, we advocate for an inclusion or a collaborative co-teaching classroom, just because with two teachers or an interaction with a special education and a regular education teacher, we find that their unique academic needs can be met more quickly. And we advocate for 504 accommodations, and when necessary, we request that a child is referred to the CSE and receives an IEP. So there are so many, and in the beginning we talked about many chronic illnesses that children may come in your classroom with. And how do we know all this information? If there isn't a medical team that can provide you with disease-specific information, there are disease-specific organizations on the website that provide a wealth of resources to support the needs of these individuals. And organizations for pediatric conditions provide recommendations and resources for educators and school personnel. So one of them is Kids Hub from New Morris Hospital. They have pretty much every chronic illness that a child may experience. They have this special needs fact sheet, and they have it for teachers, for parents, for kids. And it specifically gives you information about the specific illness, but it also provides you with specific accommodations and modifications that the student might require. And another one is the for sickle cell anemia. This is an educator's guide, and as you can see in the table of contents, it has tips for educators, helpful tips managing the student through pain, managing the student through the fever, and what each member of the school team can do in order to help that child in the school setting. These disease-specific organizations are valuable resources to support the unique needs of these students in your classroom. So the great news is that there are improved educational outcomes for students with chronic illness. And the best way to do it is to collaborate, advocate, and accommodate. So by collaborating with the parents, the medical team, and other community providers, if they have an outside therapist that might want to collaborate with the school social worker, that would be great to help the student in reacclimate to the school setting. Active planning for the differences in the classroom, advocating for those unique needs. I'm a big advocate for being very proactive for students with chronic illness, because the deficit is not going to get better. Unfortunately, the gap is only going to widen when interventions are not quickly remediated. And if necessary, to really make that CSE referral. The 504 is really something that we advocate for upon reentry, but once we see that the student is really having some difficulty, it really is imperative to start documenting that and to make a CSE referral.
Thank you so much, Cara, for presenting on this amazing topic. While you're thinking of questions that you'd like to ask Cara, I just wanted to remind you that this is the first webinar in our Alumni Education webinar series. The next one is coming up on Wednesday, August 1st, Teaching with Tech, Best Practices for All Teachers, presented by Jeanette Walters-Lennon, class of 1992, and a history teacher for over 25 years in Lindenhurst School District, Lindenhurst High School. The next one is a framework for effective teaching with differentiated instruction on Wednesday, August 8th at 4 p.m., presented by Diane Fox, class of 2008, and Director of Bilingual and Alternative Education at the Hampton Bays Union Free School District. If you would like to reserve your spot for any of these upcoming webinars, please feel free to visit alumni.sjcny.edu/webinar18. We also want to remind you that there will be a recording of this webinar sent immediately tomorrow or at the following, basically at the end of the week, and then you'll be able to view that over the weekend. And those of you who are interested can also enter to win a special 1-hour consultation with Cara. And I see that there's a question here from Maureen Delmonico. Hi, it's so nice to meet you. Maureen says, I have to go to teach class in a few minutes. Is there a way to get the PowerPoint? Cara, you did a wonderful presentation, so many new resources. In fact, I'm going to show my students tonight. Yes, Maureen, I'll definitely be sending you the presentation, so don't worry about that. I'll be able to get it to you shortly. So, Cara, I wanted to ask you, as you were talking about medications and children with chronic illnesses, I feel like medication in general for any child is always really controversial. So do you feel like medication with respect to a chronic illness for a child, is that something that's always brought into the equation, or do there have to be specific factors that determine what type of medication is appropriate and why?
Well, based on the chronic illness, there are specific medications that the physician would give. A student with cancer will have, chemotherapy, and when they return to school, they will be actually still taking that chemotherapy. So it is a medication that is really required to cure the child or to put that chronic illness into like a remission state. So it is very important, and that is why we often like for somebody from the medical team to speak with the school personnel, to really just let them know about really, the effects of that medication and how that plays a significant impact in the child returning to school. So it's really not just like, we do want the child to have some, maybe Tylenol in school for a headache, but it's really specifically that specific medication that the child is taking for the chronic illness and how that impacts them in school. Even a child with asthma and, has to take steroids or has that inhaler, that medication does have a specific impact on the child in school. So we really just need to, really advocate for that and have the school personnel really just be aware of those medications.
Absolutely.
And if the medical team is not available to do that, it's really up to the parent to share those medications with the school nurse.
We have some great questions rolling in. So viewer 10 says, Cara, great job. I'm not sure if I missed it. Are you available for a PD presentation within the home school of a returning child?
I guess I am now. I should be transitioning. I used to work at Stony Brook Children's Hospital and was specifically presented for children with cancer and blood disorders, but I'm transitioning to another position. So if I am not physically available to do it, I could definitely guide you to the resources and help you to create the presentation.
Hi, Jeanette. It's just so nice that you let us know you're viewer 10. So Jeanette's asking if you'll do a presentation for her. So I think, Jeanette, you know how to get in touch with me.
Yeah, you know how to get, yeah.
Okay, great. Thank you, Jeanette. So viewer 3, thank you so much for your question. It says, hi, Cara, this was amazing. I'm an LMSW, and it is my goal and dream to work in a hospital specifically in pediatrics. Do you have any tips?
I think that really pediatrics is where everybody wants to be. So unfortunately, it seems that there's, less and less jobs available in pediatrics. But Taryn could give you my email, and, if you want to, maybe we could, have a little email dialogue or a little phone dialogue. I could, put something together and actually maybe put you in touch with some pediatric social workers that I know that could really just help you more in that area and to give you specific tips on how they were able to break into the pediatric world.
Thank you for that question, Viewer 3. And please, just as a reminder, I will be sending a survey. So if you want to leave your contact information on the survey and indicate that you want to get in touch with Cara, I'm happy to facilitate that connection for you. And I'm an LMSW too, so good for you. Viewer 6, thank you so much for presenting this webinar. Do you know of any resources/organizations available to support teachers/staff teaching a child with a terminal illness?
So we give specific, the tips that we give are basically to support the student, supporting actually for the teachers is we just find that collaboration. If you could find somebody on a medical team that could really just give you that medical information and that support, we just find that when a teacher or faculty member really knows as much as they can about that illness, they're able then to really process it and then to seek out. It's really just amongst the school, collaborate colleagues. I mean, I don't know specific organizations, but those resources that I had told you, like the New Moors Kids Help, they have really great resources for teachers, and they may have a specific section to really where they can offer support for teachers.
I know also, just from my background as a social worker, there are great sort of info tabs within places like NASW, National Association of Social Workers. They have specific content areas that are related to chronic illness, children with illnesses. So there are information or, resources along with social work counseling, grief counseling, bereavement that can definitely speak to children and as well as supporting teachers and staff.
And I think you have to sometimes look for those disease-specific ones because they have really offer more information about that specific disease and the supports that are available.
All right. Thank you so much for joining us, Cara. Thank you, everyone, for your great questions. We love hearing from you. We will be sending you a survey, so please make sure to put your comments. If you want to hear more from Cara or you want to hear a part 2 of this webinar, maybe we want to get some other clinicians involved, like nurse practitioners or physicians or other people involved in the practice. So let us know if you want to hear more like this. And again, don't forget about that webinar series that we have coming up on August 1st and August 8th. August 1st is Jeanette's webinar, so you want to make sure that you come out and support Jeanette. Thank you, everyone, for joining us, and have a wonderful rest of your day.
Thank you.
Thank you, everyone.